So an ankle sprain is an injury that typically occurs when a patient turns or twists their foot and ankle. When their foot is fixed, their foot strikes the ground and the ankle rotates and injures the soft tissue on the outer side of the ankle called the ligaments. The ligaments bind the bone to bone, and so the most common thing that we see in orthopedics in general are sprains. And so there are ligament injuries that occur on the outer side of the ankle. Most typically, patients will come in that have said, I was playing basketball, I landed awkwardly, I turned, I twisted my ankle, it swelled, it got black and blue and bruised and swollen. They come to the office typically maybe after a couple days following their injury. They may have heard a pop. They'll describe hearing a pop oftentimes, and that just means that the soft tissue has torn in some way. When we evaluate them in the office, we want to make sure that there's no bone injuries. So we do take x-rays in the office, make sure that they don't have a fracture. And then once we can confirm that there isn't a fracture and it's an ankle sprain, most of the time we can put them in a brace, have them do home exercises, and they go home and they do those exercises on a regular basis. And most patients get better in around 3 or 4 weeks. Sometimes they don't get better. When they come back to the office and we see them in the office for the follow-up visit at 6 weeks, if they're still having a lot of pain, if they're still having a lot of swelling, then we may send them to physical therapy. Physical therapy can be anywhere from 4 to 6 weeks, twice a week, to try to strengthen the ankle, to try to work on their swelling and their range of motion. If at the end of 12 weeks they're still not getting better, they're still having pain, then we need to see why they're still having problems. Sometimes it can be because the ligaments didn't heal properly, they healed too stretched out and didn't heal strong and stable. Sometimes it's because there is an additional injury that we couldn't see on the x-ray, like a cartilage injury. And sometimes what will happen is right on the surface of the joint, there may be a cartilage defect, almost like a pothole that happened because the ankle turned and twisted and it caused something that we couldn't see on an x-ray. So oftentimes at around 3 months after an ankle sprain, if a patient is not getting better, we might order an MRI at that stage, see if there is a cartilage injury, see if there's a tendon injury, and then also to evaluate the ligaments. At that point, at 3 months out, if patients are still having pain, they may or may not have other injuries, but specifically the ankle sprain, patients will describe instability, meaning that the ankle wants to give way. They could be walking down the sidewalk, hit something uneven like a stick or a stone, and the ankle just simply turns and twists and just gives way very easily. That's a problem. And the problem can be that if they continue to have these recurrent ankle turns and twists and sprains, is it can cause further damage to the joint. And that's where we start to think about surgery. Surgery for patients that have ankle instability is one where we go and we will actually look inside the ankle with a scope to make 2 little incisions in the front of the joint and look at the cartilage and make sure that the cartilage is intact and doesn't have a defect. If it does, then we'll address that surgically. And then we'll open the ligaments on the outside of the ankle. We'll actually cut those ligaments. We'll insert small anchors into the bone and then tighten the ligaments back up to the bone. Typically, the recovery for that is they're on crutches for a couple of weeks. They may or may not be weight-bearing in a boot to follow that. And then usually they'll go into physical therapy. Physical therapy can last anywhere from 6 weeks to 12 weeks, with, again, the goal of getting patients back to activity. So in a young athlete, for instance, if they have instability that we need to operate on, we can usually get them back to the playing field anywhere from 12 to 16 weeks after surgery.